Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. According to the Mayo Clinic, scoliosis is a sideways curvature of the spine. It often occurs during a growth spurt before puberty. While most cases are mild, some cases can cause spine deformities and get worse as children grow, resulting in severe disability. Here to tell us more about the condition that affects millions of Americans is Express Care's Dr. Jitka Lom. So scoliosis, what are some of the signs and symptoms of this?
Well, as you mentioned, it usually occurs during a rapid growth spurt. So your age to look for there is between 7 and 10 years old, and then again in adolescence. And what you're looking for is that when the child bends forward, their spine isn't straight. It's kind of doing an S thing. And this tends to get worse very quickly, and it's something that should be kept abreast of.
So how would you would notice an S shape? So would you really notice it with the, like, let's say the posture of the child, or you really just see the actual spine?
You can actually see the spine. It's easiest to see when they bend forward. So it's a quick test for all parents to just have your child bend forward. Is your spine straight? Because you'll see that it's not straight if it isn't. But if they're standing up, they may be sort of hunching or lifting one shoulder, and you may not be able to tell as easily. These days with heavy backpacks, a lot of kids have a little mild scoliosis. They're carrying it on one side, and you'll start to see them hunching a little bit.
Now, do you only get it as a kid?
Typically, yeah. I mean, there's very rare conditions where people can get them out as an adult, but it's basically a condition of malaligned growth, where the spine isn't lining up nice and straight.
Now, what can someone do for treatment if they're diagnosed?
Well, mainly it's monitoring. Most people don't require too much treatment except for advice about posture and exercise. We look at the degree. It's a measurement that's taken on an x-ray. You take an x-ray and see, okay, what's the angle of curvature there? And if it's 10%, it's still okay. 20%, you start looking at treatment. And that's done with bracing, where the child wears a tight brace, actually about 23 hours of the day.
Wow.
Yeah, even when they're sleeping, to try to keep the spine straight while they're growing. If it's really severe, like 40% or even more, a terrible curvature, then surgery is done. And that's to fuse the spine and basically stop it from being able to bend.
Correct it, basically.
Yeah.
Okay, so now what happens if it goes untreated?
Well, in the most severe cases, there's a terrible deformity, and people can even have a lot of pain with that over time, and even restriction of their lung cavity, because since their chest didn't grow properly, their lungs also have not been able to expand. But those cases are more severe. Mostly it's a case of loss of height because they haven't, grown straight, and pain.
So if if your child is diagnosed with scoliosis, what can a parent do? You were mentioning, having them work on their posture. Maybe you were talking about the heavy backpacks and things like that. What can parents do?
Yeah, well, monitoring is really important. So at least once a year, the child should have an x-ray of their back and be carrying a roller bag rather than a heavy backpack. And posture exercises. Swimming is really excellent for scoliosis. Making sure that they are still exercising and staying strong in their core.
Okay, now are there any ways to prevent it, or once you get it,
No, it's actually considered to be probably a genetic condition. They've identified many genes that contribute, along with maybe some environmental factors in kids that have a poor diet.
People with scoliosis, I was reading, tend to have severe back pains.
Yeah, not all, but generally as they get older, the load on the spine isn't carrying it equally, so there may be shifting of the load that you carry every day, and as a result you get more osteoarthritis and pain as they get older.
Is there any way to prevent that, or medicine that can be taken?
Not really, because the whole purpose of treatment of scoliosis is to prevent deformity. Once you already have the deformity, then it's just dealing with it, living with it, controlling the pain as best you can, and trying to stay strong.
Okay, we have to take a quick time out, but we are continuing our discussion on scoliosis when Healthy Living returns. Stay with us.